Previously, on Can My Food Intolerances Go, I talked about how I am undergoing moxibustion and acupuncture to treat my gut issues. This treatment is an ancient Chinese practice used to treat chronic problems such as deficiency and helps to stimulate circulation by inducing a smoother flow of blood and qi. I started in August and go to EC Medforts with Kurt once a week. Although Kurt doesn't have severe problems like me, Dr. Stephen Ma says there is always room for improvement. In this episode, I will talk about my symptoms and how I noticed improvements by week 14. Hello everyone and welcome back to my channel. My name is Kieko and yes, please subscribe to my channel. So as most of you know, I have 26 food intolerances and this was caused by many factors. There's stress, then there's me taking a load of medication which destroyed my immune system, and then there's me not knowing that I had food intolerances which further damaged my gut lining. I still do have a few checkups that I need to do, like see if I have celiac disease or SIBO and see if I have a leaky gut. But yes, I have been undergoing Chinese medicine for a few months now, and as you all know, Chinese medicine takes a really long time and it is well known for getting to the root cause. So the question is, have I seen any improvements? So first, let's talk about my symptoms because I have many symptoms and maybe you have also experienced these symptoms but ignored it because you thought it wasn't a big issue. So number one, irregular periods. So when I was young, I used to skip my period a lot and I ignored it because a few other people I knew skipped their periods and I thought it was normal, until I realized that it's actually not normal to miss your periods. So then when I turned 21, that's when I changed up my diet and I became vegan and I was on a plant-based diet. And I also did a lot more exercise. When I was 18 or 19, I went in for a scan and they told me that I had PCOS, but after changing my diet and going back for a scan, they told me that my PCOS had disappeared. So yeah, if you do have irregular periods, make sure that you get that checked up. The second thing was tonsil stones. So if you don't know this, you can Google it, but it's basically this really horrible ball that you get at the back of your mouth, and you can get several, and it's kind of white or creamy in color and it smells really bad. So that's basically like fungus, and your body is rejecting this fungus. So yeah, these tonsil balls would increase whenever I took a heap of antibiotics. Number three, I had a thick white layer at the back of my tongue and I had to use a tongue scraper to remove it. It wouldn't 100% go, but if I didn't use a tongue scraper, then every time I ate it would taste weird or I couldn't enjoy tasting water. Number four, I had reoccurring yeast infections for 5 months straight. This stopped when I went on this thing called the Candida diet, which I researched, and you cut out gluten and wheat. Number five, easily getting sick. So I would get sick really easily because obviously my immune system is weak, so I was prone to getting tonsillitis, sinus infection, UTI, just any type of infection in the body. Number six, insomnia. So I have trouble sleeping. I tend to sleep really late at night, but before I could only sleep for a few hours and I kept waking up in the middle of the night, and I also had a lot of crazy dreams. Number seven, depression and mood swings. I'm sure there was a lot of other reasons as to why I was getting mood swings or feeling depressed, but this seems to happen in a lot of people who cannot eat gluten and wheat because you are on such a strict, restricted diet. You can't eat outside, you can't have the social life that you want. Also, you're not getting enough essential nutrients that's important for brain function, and that can result to depression. Number 8, bloating and constipation. Number 9, skin problems such as acne and rosacea. Number 10, tooth decay and stains, which I'll talk about in my next video. Number 11, eye bags, which is very common in people who have gluten and wheat allergy. So maybe sometimes I look really tired in my videos and I'm actually not tired, it's just gluten and wheat. And that goes on to number 12, feeling tired even though I've had 8 hours of sleep and I've probably slept really well throughout the whole week, but I still feel really exhausted and really foggy and exhausted. And number 13, the last one that I could think of, was water retention. I get really puffy and like bloated, especially around my thigh gap area and face, and yeah, like the puffiness of my eye bags. And I think having food intolerances or food allergies can cause a lot of water retention inside your body.
So far, what has acupuncture and moxibustion done for me? Dr. Stephen Ma has helped regulate my period, not just so that it comes once a month, but making sure my flow is heavy from day one and so that I don't get cramps before I start. I no longer get tonsil stones, and the thick white layer on my tongue has become very thin and is slowly disappearing. Your tongue should be red. If it's not, it's a sign of deficiency in your body. I am sleeping a lot better. I can sleep without waking up in the middle of the night and have less dreams. There has also been a reduction in water retention and puffiness. In my previous videos, you probably saw that my face was a lot rounder. I also had very big eye bags. Now my face has become slimmer and my eye bags are slowly going down. I used to have like a double eye bag, which was not only embarrassing but made me look like I never slept. My skin doesn't really get red anymore. Before, I would flush easily and look like I got sunburn. Now it's always calm and I would get occasional spots and rashes, but this will disappear within 3 days. Whereas before, my spots were big and took around 2 months to disappear. We are now working on my constipation because I still can only go to the toilet once every 3 days. Not only is this uncomfortable, but I get a bloated stomach. Kurt continues to drink Chinese medicine and does acupuncture. Dr. Stephen Ma is helping his chi flow better as it is currently concentrated in one area. Dr. Stephen Ma says we should continue to do moxibustion and acupuncture as he believes this is the best treatment for me.
So yeah, if you have any questions or you're experiencing something similar to I am, please leave a comment down below and we can have a discussion and talk about things. But so far the Chinese medicine is working and I have seen improvements. I'll see you in my next video. Bye!